Right, so I haven't talked about my vocal cord issues in quite some time. And part of that was because I was really having a hard time coming to terms with how it all went after the surgery and after the post-op period and after going through speech therapy for quite a few weeks. I think I went to speech therapy for about 8 weeks. So what happened was, after going through speech therapy for a number of weeks, you go through an assessment. And what it is like you first do your first self assessment with the speech pathologist. And what gets determined is where you are, so your baseline or of where you are at the moment. It could be done before your surgery and then after surgery, and then you do it a few weeks after you've had, after you've recovered from the surgery and after you do speech therapy for a number of weeks. And what happened was I was experiencing the amount of recovery that you should have seen after that number of weeks. And I have to tell you, I was doing my exercises religiously. I was putting everything into practice that the speech therapist was telling me to do. I would wake up and do the exercises. I would go through the day and do my exercises. I would hydrate. I was never a big water drinker. I drink water mostly. I don't drink anything else other than maybe water, coffee, and tea. I did reduce my caffeine intake tremendously. I was a big coffee drinker. I would drink, maybe 3-4 cups of coffee a day. I went down to one cup of coffee a day. Everything that the speech therapist told me to do, I did religiously. And I was not experiencing the amount of recovery that I should have seen for the amount of time that I was doing it. So I was getting very, very frustrated with the whole thing. So because I was getting so frustrated, and the speech pathologist, even though she believed that I was doing everything, she felt that maybe I wasn't doing it right, or something was not okay. And eventually she gave me a referral to a laryngologist that she knew. And she said, instead of going through the surgeon this time, I want you to go to see my very trusted laryngologist, and he will be able to tell us if there's anything going on that we need to know about. Maybe you have an additional polyp. Maybe there's something else that we are not seeing as patient therapist, diet. We are not addressing, we're not seeing something may be going on that we need to pay attention to, and we are not doing that right now. So I made an appointment, and I went to see this vocalist. This laryngologist. She's the vocalist. He was a laryngologist, and he was a very trusted person by her. And, he did all the exams with the stethoscope, and they did one where they asked me to say things while they had a camera in my larynx, in my voice box. They asked me to say things and produce sounds, and it was very, very uncomfortable. But they did do that, and it was for a few minutes, so it was quite uncomfortable. But I got through it, and after he was done with that, he basically gave me the news that what he was seeing was basically scarring, tissue scarring. And that was the first time that I heard that, because I had done this before, the same exam before, with a speech pathologist. I had done numerous other exams with a surgeon. They had actually gone in and removed a polyp, a huge polyp from my larynx, but I had never heard before that I had scarring of the tissue. So basically, once you have scarring of your larynx, there's really very little that anyone can do. So that was that. And after I went to see this laryngologist, I had my appointment with the speech pathologist. And that was basically the last appointment I had with her, because once you have scarring, there's very little that a speech pathologist can do. Scarring will always be there, and there is no surgery really for it, other than maybe a steroid treatment that he suggested that I do. But he could only guarantee maybe a 15% improvement. And in my case, because I had a very strong gag reflex, people do it without with anesthesia. But for me, it would be impossible to introduce an object through my throat and actually inject steroids into my larynx without me being asleep, because I feel like just the fact that I know that they're introducing an object through my throat into my larynx would really provoke me to start that gag reflex, and it would be impossible to do. So that's where I left things. So needless to say, would I do this over again? Would I do the surgery? Would I get the surgery over again if I had the opportunity? The answer to that is still yes. Why? Because when the polyp was removed, I feel like there was a huge improvement in the way I feel at the end of the day. So before the surgery, when the polyp was still there, I remember getting to the end of a day and being really fatigued, really tired. And it was a very specific type of tired because it was here and here, because I constantly had to make an effort to speak. And even though right now I sound like I'm making an effort to speak, in reality, I'm not really making that much of an effort. Having a raspy voice is kind of my normal in a way. So this is my original voice. I always have a raspy voice. I don't think that, if anything, this is kind of like my trademark. So I could speak like this all day, and yes, maybe I'll be tired at the end of the day and need a little bit of rest, but it's nothing compared to the way it was prior to surgery. So would I still get surgery? The answer is still yes, believe it or not. And in terms of the scarring, when I saw this laryngologist, I asked, is this scarring because of surgery? And he said, maybe, but this scarring could happen for many, many reasons. And you have scarring on both sides. So on the left vocal cord and on the right vocal cord. So there is no evidence that it was really the surgery, because if it was just a surgery, it will be localized to that area. And you have it in both vocal cords and in the entire section. So it's possible that the scarring was there from prior to the surgery, and the surgery just improved your outcome, but it did not do anything to make this voice quality improve. But personally, I have to say my quality definitely improved, because I don't feel that I have to struggle so much to speak. It sounds as if I do, but me knowing the way it felt before and what it feels right now, I have to say that the surgery did definitely mark an improvement for me. And if I had to do it over again, I probably would do it over again. The best thing is not to get the polyp or the nodule to begin with. But if you do get it, I do still recommend that you do. But I do recommend that you speak to a speech pathologist that specializes in vocal cord issues and polyps and nodules before you embark on the journey. I definitely do advocate for that. So I have a couple of pieces of advice. Number one, definitely get in touch with a speech pathologist that knows how to deal with vocal cord issues. You can always speak to mine. In the previous video, I left a link, but I can leave the link again here. And number two, to see someone who really knows about all the possible outcomes. I was told that my voice was going to improve 100%, and that wasn't true. It did improve, yes. I would do it, like I said, I would do it all over again just because of that. But it's not, I can't be a singer, for example. I still do have that raspy voice. And number three, accept that it's not, that, it may not be 100% outcome that you want, but if it's something that does help you at the end of the day, then by all means, explore that option. All right, guys, so I leave you with that. And don't forget to check out my other videos if you want to know what the journey was like for me. It wasn't an easy decision, and I don't think it's going to be an easy one for you. But I'm hoping that with these videos and with my experience, you get to make an informed decision yourself. I wish you the best of luck on your journey. Thank you. Bye.